knee ligament injuries are extremely common. The most common ligament injury in the body is actually the ankle. But as far as the ligament injury that disables people the most, it's actually knee ligament injuries. Most athletes that are excellent, the injury that most commonly disables them so they can't do their sport, whether it's just a common athlete like myself or a college athlete or a professional athlete, it's actually knee ligament injuries that actually cause them to not be able to do their sport, and often they have to retire prematurely. What most people don't realize is that the actual cause of knee arthritis, right, the most common joint replacement is from knee arthritis. The arthritis actually starts with ligament injury. The most common ligaments in the body are the medial collateral ligament, which is shown right here. This is the lateral collateral ligament. But the ligament that actually most commonly disables the knee is actually called the anterior cruciate ligament. So the anterior cruciate ligament is actually right here. So you can see it right here. So that ligament actually causes the tibia and the femur not to move excessively one on the other. So when any of these ligaments are injured, it puts a stress on the other ligaments. So in other words, if the medial collateral ligament is injured, there's going to be excessive motion on this side of the knee. When there's excessive motion on this side of the knee, it's going to cause the anterior cruciate ligament to be under stress, the posterior cruciate ligament to be under stress, the lateral collateral ligament to be under stress. So that's one of the reasons why at Caring Medical we do comprehensive prolotherapy. So in other words, you may have as your primary injury the inside of the knee, the medial collateral ligament, but I might choose to do a lot of the ligaments because they're also injured. They may not be your major injury, but they're also injured. You know, you can't have excessive movement on here and it not affect this part of the knee, especially if you've had that problem for months and months or a year, 2 years, 3 years. Now, the other thing that people don't realize is when you have a meniscal injury, here we see the medial meniscus. Meniscus tears and meniscus injuries are very, very common. They cause clicking, locking, swelling of the joint. So when someone has clicking, locking, swelling of the joint, you probably have a meniscal tear. Meniscal tears typically start when what? And I'll illustrate this. So if you have someone who's jumping, you know, when you jump or you run, your knee joint, the pressure is just like this. But if you have a ligament injury, like a medial collateral ligament injury, and you run, it means that when you're running, the two bones, the tibia and the femur, there's going to be a twisting. So you take a step, boom. You take a step, boom. You take a step, boom, and that's what eventually causes the meniscus to tear, right? So if you're going up and down, like you're running and the ligaments are strong, there's not a shearing force on the meniscus. But if you take a step and there's a twisting, like little twists, that's what causes the meniscus to go. And once the meniscus goes, it's not going to repair. Ligaments are white. You could see on the model, basically a dull color. And then the meniscus is also white in the human body, meaning that the blood supply is terrible. So ligaments that are injured, meniscuses that are injured, they heal terrible. That's why, you get physical therapy, you try exercise, you change your exercise regime, and it doesn't work. So that's why you end up with chronic pain, chronic swelling, and you end up seeing someone for prolotherapy. Prolotherapy for meniscus tears, meniscus degeneration, prolotherapy for ligament injuries about the knee is a great treatment because it causes the ligament to get stronger, causes the meniscus to get stronger, and then when it has sufficient strength, the athlete can run, they can jump, they can go back to all their activities. The other wonderful thing about prolotherapy for knee injuries is, it stops the arthritic process. And you could say, well, doc, come on, what proof do you have of that? You got to realize I've been doing this for 20 years. Before me, Dr. Hemwell was doing it for 40 years. So I might see somebody that Dr. Hemwell saw 40 years ago for their knee. And I see the person and they're fine and they're now, 80 years old and they've been completely fine. So to me, the best evidence of prolotherapy stopping the arthritic process is walking evidence. It means that the patient, they're fine. Like, I never saw them again, or Dr. Hummel never saw them again. You know, they had ligament injury in their back, their neck, their knee, their ankle, right? We didn't see them again. It's not like an orthopedic surgeon, or, you know, you have injury after injury and surgery after surgery. They got prolotherapy. It resolved the issue. We actually repaired it, so the strength is back to normal, and they're fine. So that's another reason to get prolotherapy, is once you're done, you're typically done. It's resolved. Have a nice life. Like, I don't want to see somebody long-term. The number of long-term patients we have at prolotherapy is like 0. It's not. Prolotherapy repairs it, so if it's repaired, then you're fine. So that's just another great thing about prolotherapy. You just don't need chronic treatments.